Let's go ahead and learn everything we need to know about hypothyroidism. First of all, we're going to start with the fact that the thyroid sits in our neck, and let's understand the pathophysiology. Hypothyroidism is insufficient production of the thyroid hormones. The main thyroid hormones are T3 and T4. We're going to talk in a little bit about TSH, but the thyroid produces hormones T3 and T4, which are primarily responsible for the metabolism of our cells. Okay, so our cellular metabolism, the metabolism that we talk about here is not the same as our GI metabolism. This is our cellular metabolism. And it has a big impact that we'll see in a second on signs and symptoms. The most common cause globally of hypothyroidism, though not in the United States, is iodine deficiency. Iodine is necessary for the thyroid to produce T3 and T4, and globally that is a problem. In the United States, that's extremely rare. So in the United States, hypothyroidism is most commonly caused by Hashimoto's thyroiditis, which is an autoimmune disease. It can also be caused by a pituitary issue, or it can be caused by a partial removal of the thyroid or a complete removal of the thyroid. And that would be because we were treating hyperthyroidism, which we'll discuss in a separate lecture. The result in any of these cases of hypothyroidism is a slow metabolic rate. Let's look at the signs and symptoms. What does that slow metabolic rate mean? It means the patient's going to have a low body temperature, a low heart rate, low respirations, low energy level. They're going to have an increase in their weight. They're going to have brittle hair. They're going to have cold intolerance. They may have depression and chronic fatigue. They may have constipation and brittle nails. So lots of different symptoms that the patients can have. And this constellation of symptoms, if you ever see this, this whole low everything, low temperature, low heart rate, low respirations, all of this, especially with weight gain, all of this is classic for hypothyroidism. There is something else called myxedema. It's commonly called myxedema coma or myxedema crisis. Myxedema is an extreme manifestation of all of these symptoms, and it's where their hypothyroidism has gotten out of control. And in those cases, we're going to have a severe issue with all these symptoms. So really low temperature, really low heart rate, really low respirations. In those cases, the patient's going to have a low mental status, almost to the point or even to the point of being completely unconscious, which is why it's sometimes called myxedema coma. Let's look on the left side for diagnostics. Diagnostics, the first test we use is TSH. And in fact, this is part of the standard test that every one of us gets every year we go to the doctor. A TSH is a thyroid stimulating hormone. So what is that? Thyroid stimulating hormone is exactly what it sounds like. It stimulates the thyroid to do its job. So if I have a lot of TSH, that means I'm needing the thyroid to be doing a lot of stimulation because it's not doing its job. If the thyroid's not doing its job, there's going to be a high TSH because TSH tries to get the thyroid to do its job. So again, before I confuse you, a high TSH means that the thyroid is not doing its job, means that there's a low thyroid level. This is what's called an inverted lab because a high TSH actually corresponds to a low thyroid level. So T3 and T4 are the main thyroid hormones that we mentioned a minute ago, and those are what the thyroid produces. In hypothyroidism, those will be low. In hyperthyroidism, those will be high. But the TSH is inverted. The TSH goes opposite of T3 and T4. When T3 and T4 are low, like with hypothyroidism, the TSH will be high. Why? Because the TSH is telling the thyroid, produce, produce, produce. And so the more it's having to yell produce, that means production is actually low. There is also under diagnostics listed as an ultrasound. That would be an ultrasound of the thyroid. Very often we would do that for a goiter or we do that for an initial workup on a patient that was newly diagnosed with hypothyroidism, but that's not super common. Most of the time, this is just diagnosed based on labs and physical assessment or HPI. Next, nursing assessments. What are you going to assess? So the first thing you're going to assess is all of these signs and symptoms. You're going to assess, are they having the low temperature, the low heart rate? Are they having fatigue all the time and low energy? Are they gaining weight? Do they have depression and constipation? Do they have this whole set of symptoms? Because this is pretty textbook in most patients. That's the first thing you're going to assess. But in addition, you're going to assess, do they have a goiter? So you're going to assess their neck and see if they have a goiter palpable or sometimes even just completely obvious without palpation. You're going to check their labs. Do they have that high TSH and do they have that low T3, T4? And if they're on medication, you're definitely going to assess for medication compliance because the medication we have for hypothyroidism works perfectly well. So if they're coming in with these signs and symptoms, you're going to assess to see if they're having any issue with their medication compliance. Nursing priorities is going to be airway, breathing, circulation. So we know that breathing can be an issue. They can have a low respiratory rate, especially when we get to mixed edema coma. So we're going to check their breathing. That's going to be a priority. We're going to check their circulation because they're going to have a low heart rate, which can have a low blood pressure. If they're in a severe mixed edema state, a severe state of hypothyroidism. So those are going to be your priorities. Additionally, as far as taking action, your priorities are going to be to make sure the patient gets their medications. The treatment for this is straightforward. It's levothyroxine. Levothyroxine is actually T3. Or I'm sorry, T4. T3 is triiodothyronine, T4 is thyroxine, which levothyroxine is a synthetic version of T4. So levothyroxine is what the thyroid is supposed to be producing. If the thyroid's not producing it, thankfully, we have it in a pill. So the patient's going to take levothyroxine. The brand name for that is Synthroid. This is one of the most common medications prescribed in the United States. And a few interesting things to know about this. First of all, this drug is available in more doses than any other drug. I haven't seen that anywhere, but I'm saying that based on experience. I could be wrong. But this drug is available in 12.5, 25, 37.5, 50, 67.5, 75, all the way up to 300. So this drug is available in every dose interval possible. Why? Because we want to get the thyroid exactly correct. So the body knows exactly how much T4 to produce. If the body's not doing it, we give you medication. But we're not nowhere as good as the thyroid. So we need to try and get it right. So first of all, if a patient's getting treatment with levothyroxine, they're going to need their labs checked, usually every 6 to 8 weeks until we get it perfect. But we're going to try to get it perfect. So we might start the patient on 25 or 50 or whatever, and we're going to go up and down in pretty small increments in order to get it perfectly right, because we want everyone's TSH and T3, T4 to be perfectly normal. So again, levothyroxine is a treatment for hypothyroidism. This medication, moving down to client education, it should be taken in the morning on an empty stomach. You should not take it at night because it gives you energy and you don't want that right before bedtime. And also this medication, you need to tell the patient they're going to be getting frequent lab monitorings, usually every 6 to 8 weeks, in order for us to get the thyroxine level to exactly where it should be with this medication. Once we get it to the right level, then usually they could just get their labs done every 6 months. Also, you're going to educate patients on the disease. You're going to educate them on the signs and symptoms. If you notice you're having low energy, if you notice you're gaining weight, depression, things like that, please come in so that we can check your medications. We're going to talk in a separate video about hyperthyroidism. So in that one, you're going to see the exact same stuff, but the opposite. And we'll go over there into the different treatments and the different path over there. But the patients in both cases, hypo and hyperthyroidism, need to be educated on the signs and symptoms of the disease so they know what to look out for to see if their disease is getting worse, or maybe if they're taking too much medication, if they're heading in the other direction towards hyperthyroidism. Complications, we already mentioned, would be mixed edema coma or mixed edema crisis, which is a severe manifestation of the patient developing hypothyroidism and the signs and symptoms associated with it. If you have any questions, please reach out. Best of luck in class. See you in the next video.